And I think we'll go ahead and get started now because we are about 4 or 5 minutes after, and we have some folks that need to jump off. Um, First, I want to say thank you so much for joining us. Welcome. My name is Keith Wallington. I am with the Justice Policy Institute. More importantly, I'm part of a larger effort of organizations, individuals, and families working on behalf of our incarcerated population and loved one, with a particular focus on efforts right now during the COVID pandemic. I want to particularly thank families for joining us, and Mr. Alonzo Turner Bay, who will speak from a very recently lived perspective here shortly, and also to Senator Carter and Delegate Wells, who I know has to jump off. So I'll jump over to you in a second, Delegate Wells. The purpose of the event today is to highlight a population that has been left in harm's way as a result of the COVID pandemic. Despite the COVID pandemic getting progressively worse over the last several months, there's been still no meaningful plans in place for keeping our incarcerated population safe. Governor Hogan has followed the advice of public health officials in every other area except for the incarcerated population. Just as the incarcerated population it sits no differently than a nursing home population. And as you saw, his first executive order that he put out last April really spoke to that population, but again, not to the incarcerated population that sits very similarly. We're also fortunate to have Dr. Breyer from Johns Hopkins today, who will speak to us from a public health perspective on what the state should be doing. We're here today to demand better efforts to protect the incarcerated population. Governor Hogan's latest executive order, just like the one he issued at the end of last year, leaves too many people in harm's way, including many people that the Maryland Parole Commission have recommended for release, but who the governor did not sign off on. And for those who are left in harm's way, those that are left, do not have the basic PPE or other CDC recommendations. Recommended needs to keep them safe. And if you look at the recent outbreaks, we see the situation is clearly getting worse with no meaningful plans in place to keep residents or staff safe. For example, if you look at the North Branch Correctional Institution in Allegheny County between November 9th and December 7th, 224 incarcerated individuals and 92 staff tested positive. The positivity rate during that period was nearly 80% for staff and 23% for the incarcerated residents versus about 8.7% for the state. From November 13th through November 16th, all tests, 56 incarcerated residents and tests that were, staff there were positive. And if you go over to and look at Eastern Correctional Institute in Somerset County, during that same period between November 9th and December 7th, 515 incarcerated individuals and 68 staff tested positive. Testing must be the voluntary standard, and the vaccine must be made available to everyone who is incarcerated and working in these places. For those who are rightfully hesitant to take the vaccine, we need an education campaign aimed strictly at staff and incarcerated individuals. I know Delegate Wells has to go, so I'm going to stop rambling and turn over to her. We are so fortunate to have folks like Senator Carter and Delegate Wells joining us on this call and on this effort, and willing to speak out on behalf of the most vulnerable population during the COVID pandemic. You have families and constituents who are grateful for you and your efforts. And with that, Delegate Wells, I'm going to kick it over to you because I know you have to jump off early.
Sure. Thank you so much, Keith. Also, thank you to the coalition for inviting me. I'm Delegate Melissa Wells. I represent the 40th District here in Baltimore. Also, I'm here today on behalf, in my capacity as the first vice chair of the Legislative Black Caucus of Maryland. And I just want to thank all of you for this incredible work that you're doing around making sure that our individuals that are in facilities that are incarcerated, as well as our employees that are working in the facilities, that they are staying safe, and that we're being mindful of the best way to keep them all safe from this horrible and deadly virus. And so I think what I want to just share is that, like, why this is so important to the Black Caucus is because Maryland has the highest incarceration rate out of any state for Black people. And so we already know how much this disease is ravishing and, further laying bare the disparities that have affected the Black community. And because of for those reasons, we really need to make sure that we're looking at all options to make sure that we are keeping folks safe. The governor has, made some inroads in terms of at least acknowledging that there needs to be an approach to releasing some individuals that could benefit from release and already are primed for release. But we could also be being more intentional about really lifting up that there are a lot of comorbidities associated with this virus, especially around hypertension, heart disease, and diabetes. And we know that unfortunately, our incarceration, our prisons don't have the best healthcare for individuals. And so I believe that there is really a large number of folks that are very susceptible to this. And we've seen in the numbers in terms of those that have been found positive. And so I think it's important that we continue to urge the governor to increase the number of individuals that could be released. And also it's important not only for the safety of those that are incarcerated, and it's also humane for those that are incarcerated, but also the safety of our employees. And I think the last thing I want to add is that 80% of individuals currently incarcerated in Maryland who are Black have terms of at least 10 years or more. And so we know that we also want to do all we can, since they may not be primed for release anytime soon. We don't want to increase their risk of exposure. We don't want to also increase the risk of spread. And so to the extent possible that we can allow folks to leave, to be on home detention, or who are already prepared for parole or close to their parole date, to allow them to leave, we really should be exploring it. And then also we need to make sure that we're prioritizing our prisons and our jails and our detention facilities for the vaccine. I have not heard that plan as of yet. I'm sure that we might hear more about that on today's briefing, but I definitely just so you know, just please know that you have the full support of myself and also of the Legislative Black Caucus to make sure that we address this issue that overwhelmingly is affecting Black Marylanders. So again, I thank you for your invitation. I thank you for your time, and I thank you for all of the advocacy that you are all doing to address this issue. Thank you.
Thank you so much, Delegate Wells. We are immensely grateful for your leadership and your efforts and your understanding of the issue and the broader issue around the racial disparities and the impact, how COVID, is just a double jeopardy for a lot of African Americans who are already, as you said, Maryland leads the country in racial disparities in the incarcerated population. Thank you so much, and we look forward to working and supporting you. Senator Carter actually just reached out. She's having some technical issues, but will not be able to join us, but sends us her full support. So we look forward to working with her as well. And with that, I do want to go to Dr. Chris Fryer of Johns Hopkins University to speak to us about, from a public health professional perspective, about what the state should be doing. Again, we talked about how Governor Hogan and the state has followed the advice of public health professionals in every other area except the incarcerated population. So right now, I'd like to hear from one of the top public health professionals in the state, Dr. Breyer.
Thank you so much, Keith, and good morning, everybody. Well, I think everybody in the public health community has been very concerned since the beginning of this outbreak that prisons, jails, detention facilities, like long-term care facilities and nursing homes, were going to be hard hit by COVID. And that is because this is a virus that is much more transmissible indoors rather than outdoors. And it is very much affected by density and crowding of populations. So what we see across the country, and certainly in Maryland, is that we pushed early and hard for decarceration to reduce that overcrowding, to get as many people out of these facilities as possible in advance of the pandemic. That didn't happen. The numbers of releases have been too small. The crowding has continued. The second set of recommendations after decarceration, which is the first and most important ask and call, is the basics of doing what we've all been asked to do, which is wearing masks, having access to protective equipment, social distancing, good hygiene, hand washing. Those things are incredibly difficult to do in prisons and jails, and also in Maryland have been inadequate and insufficient. So the second big ask is a simple thing, the basics. PPE, no charges for soap, and disinfectant. Again, reducing crowding so that people don't have to be in crowded congregate spaces. All those things are incredibly important. However, we have to be honest, we have to look at the data, and the state is to be congratulated because one of the things we called for early on in the spring was for access to the data and public access to the testing results. And that now is up on the new website that the Department of Corrections is running. The news is not good. So just in the month of December, the number of positive cases among detainees in the state doubled in 1 month. So that is, and that's, of course, December was a tough month all across the state and the country. That is a wave that we knew was going to happen, but a doubling of the incarcerated population is just totally unacceptable. And what that tells you is that the basics of what we've been asking for, decarceration, PPE, sanitation, not happening. Insufficient to address this, and this really, unfortunately, looks like an epidemic out of control. So we want to ask for those basics. We think that's very fundamental. We still think it's critically important, as the delegate just said, to focus on decarceration and reducing that overcrowding. But now we have a new tool. We have just entered the era of COVID vaccines. We have 2 vaccines that have emergency use authorization. They're both these messenger RNA vaccines. They're not fully approved by the FDA yet, but they do have emergency use authorization. The trials were well done and rigorous. And full disclosure, I have been working on the COVID vaccine trials prevention network as an epidemiologist. So I've been very involved in the Moderna trial. The Pfizer trial was not done by the NIH, but these 2 vaccines have 94 and 95% efficacy. They are incredibly effective. They also have good safety profiles. We're still following along everybody who's been in those trials to learn more about the safety. And of course, we have prioritized healthcare workers, frontline workers, and people in congregate housing facilities like nursing homes across the country and in the state. And that is very appropriate. But as Keith said in his opening comments, and it's absolutely the case, people in incarcerated facilities, carceral facilities, are not dissimilar to people in nursing homes. Again, they're crowded indoor facilities. There are many people with chronic and underlying health conditions. There are many people over age 65. And of course, the staff of these facilities are like the staff of nursing homes, and they have had very high rates of COVID in this state. And there have been a number of deaths. And of course, there have been a number of deaths of inmates. So what are we calling for? What we want to do is to see that the staff and the people in Maryland's prisons, jails, and detentions are prioritized for vaccine access. It has to be voluntary because these are not approved vaccines. We can't mandate people to get a vaccine until they're approved, but we certainly should be offering them to anyone who wants one. And at an absolute minimum, everybody in detention ought to be treated in the same way as people in the community for vaccine prioritization. So that means people over 65, people with chronic and underlying health conditions, people who would be vulnerable to having a severe COVID case if they did have an exposure. Because the fact of the matter is, despite trying, I think, in a genuine way, we have failed to protect these people. And when you have a doubling of cases in 1 month, you know the basics are not working and you are not able to protect these people. So now it is time to decarcerate, keep the PPE going, but also add access to COVID vaccines as part of our way of mitigating this. We have taken these people's liberty away, and we have a responsibility to their healthcare, and that responsibility extends to COVID vaccination for those who want it. And I'll stop there.
Thank you so much, Dr. Barr. And if we could, we'll hold off on questions until the end. And a reminder, if media could please drop your contact information in the chat. And we also have with us today Mr. Alonzo Turner Bay. It is the Mr. Alonzo Turner Bays of the world that we do this while we are all here. And Mr. Alonzo Turner Bay, recently came home and is going to speak to us from a very lived perspective and give us a very clear understanding of what our current incarcerated loved ones, how they're still sitting in harm's way of COVID. Mr. Alonzo Turner Bay.
Yes, can you hear me? Yes, my name is Alonzo Turner Bay. I went to prison at 17 years old. I served 31 years, 6 months, 15 days. I was recently released from Jessup Correctional Institution in Jessup, Maryland. Right before I left, the housing unit I was in had a real bad outbreak of COVID. I was fortunate enough to make it out because I suffer from multiple underlying conditions. I have asthma, I have high blood pressure, and I have some kidney issues that has developed since I was in incarceration. PPE being distributed in Jessup Correctional Institution is not being done. Before I left, the security chief, she put out a memo stating that if a prisoner was found to be making a face mask out of his own clothing, like for example, if I was to make a face mask out of his black t-shirt, the results would be I would be placed on lockup and given an infraction for destruction of my own property. The reason a lot of us turned towards making face masks out of our own property is because at the beginning of the pandemic, the warden came out with a memo saying we will be given a face mask, a face shield, and latex gloves. Every inmate will receive these. Well, we were not given no face shields. We were not given no gloves. We was given one face mask that was made out of khaki material, out of uniform materials from our MCE, which after you wash it a few times, they're elastic, become outstretched, and you couldn't hold it on your face or hold it on your face as snug as you to protect yourself. So we resorted to making our own. Some men was placed on lockup. Some officers confiscated homemade face masks. And as for the shields, when we began to question the security chief, Ms. Antoinette Washington, about this, she said, the reason we are not giving y'all shields is because one of my officers may have to mace one of y'all. And I was astonished for this woman to say something like that. The reason that she refused to protect the lives of the 2,000 men at JCI, it hurt because before I left, I had a friend who got sick and I pushed him to the hospital. And lo and behold, he died. COVID killed him. And so this is important to me because this is a man who taught me a lot. This is a man who helped me along the ways because I came to prison as a kid. And I'm watching men die in there, men who I respect, men I look up to, all because the staff is taking this as a joke. There's no contract tracing. On July 29th, a sergeant in my housing unit, she tested positive, Sergeant Bird. None of the other 8 officers who worked with her were put on quarantine. They was allowed to stay at work that day. They was allowed to roam through the prison freely. Officers are not wearing their mask properly. They're just covering their mouth. And then when they leave off the tier, they take the mask off. The staff at Jessup Correctional Institute, the Department of Public Safety and Correctional Service are not handling this pandemic the way that it should be. The prisoners are trying our best to protect our lives, but we can't if we are not being given that which we are supposed to be given. And in cases where we try to do things to protect ourselves, we are being punished. So in all, we are being punished. In reality, some of us are taking it like, man, they want us to die. They want us to die. Decarceration needs to happen. We're calling on the Department of Public Safety, the Parole Board, and the governor. I'm saying, you are saying you're gonna let people who with a nonviolent offense, who within 4 months go home. I'm saying include everybody, regardless of your charge. Let's not look at 4 months, let's look at 1 year. Anybody who is due to be released within 1 year, let them go home on home monitoring. Let them go out. Start restoring good days to the men and women who may have lost them so it can go home. If a woman is due to be released in 1 year, let her go home tomorrow. If she has good days that can put her out the door or put her within a 1 year release date, give them back to her. Give these people their good days back, start releasing them. Start unclogging the system. Start letting the parole board do their job. I'm calling on Mr. Bloomberg. Start giving speed up some of these parole hearings. Give these men and these women the opportunity to earn their freedom. Stop lagging behind, stop postponing them, because we are dying inside these prison walls because of y'all refusing to adhere to what the professionals and the experts are telling you to do. If you rely on the public health experts to do this and to do that, and they're telling you to decarcerate, decarcerate. If they're telling you to give us the PPE, give us the PPE. Because we're dying when you are refusing to listen to the professionals.
Thank you so much, Mr. Alonzo Turnabay. The lack of planning and response by the state is not only creating nightmares for the men and women that are inside our institutions, but it's also creating nightmares for their loved ones. And we have a couple that are on the phone, that are on the call with us today. And I'm going to go ahead and go to Miss Elaine Seipel.
Eileen,
Please.
thank you. Good morning. Obviously, one of the simplest ways that we can decarcerate is to release the men and women who are in prison who are parole eligible. But our parole system seems to be breaking down during this time. At least that's been my experience. My son is incarcerated in Maryland. He's been there for 9 years since he was 16 years old. His prison is currently having a significant outbreak of COVID-19. During his incarceration, he's not had any infractions. He earned his GED. He completed a job training program and then went on to become an instructor within that program. He has a thick file for the parole board that's filled with letters of support from the community, from a couple of officers within his facility, from his instructor at his job training program. I mean, he's done everything right. He has worked so hard to be released from prison and to start a life for himself. On his release, he has a couple of job offers already waiting for him. He actually spent his time in prison contacting potential employers, telling them his story and saying, would you be willing to give me a job interview? He has a stable home to live in with people who love and support him. He has reliable transportation. Everything is lined up for him. His earliest parole eligibility date was January 9th of this year. So in November of 2020, we had not heard anything from the parole board. So I called them and I was told to expect his hearing to be held in December of 2020. In December, we had not heard anything. So I called them and I was told early January, probably. And in fact, one woman I spoke to actually said that all of the routine parole hearings had been backed up at least 2 months because of COVID. And when I mentioned to her that I was working with this coalition, she immediately backed off from that and said that she had never said that, but she did. Now here we are halfway through January, and the parole board is telling me most likely his hearing will be in early February. But as of yesterday, that's not been confirmed. They haven't returned my phone calls. We still have no parole hearing date. And it's frustrating and it's really disheartening because he's done everything right. And if our prisons are supposed to be designed to help people rehabilitate, he's done that. If we take away his goal, then he has nothing left to work for, and that's not fair. And it's not fair that we are pulling that out from under him. It's not fair to him. It's not fair to his family. And I think the thing that really bothers me the most is that as a family member, I'll keep calling the parole board. I will work with coalitions to make sure that he gets the release that he's entitled to. I'll do what I need to do, but everybody doesn't have that. And I just really feel like the parole board will get tired of hearing from me. So they'll eventually give him his parole hearing, and hopefully he'll be home shortly after that. But how many people are inside who don't have families calling the parole board? And so they're just sitting there and they're waiting to hear from something that may or may not even happen. It's just not fair. It's just, we have to do better. January 9th, I really thought he'd be home on January 9th, and we don't even have a parole hearing yet.
Thank you, Ms. Seipel. Before we go to questions, I would like to hear from one more family member who we have on, Ms. Carolyn Bates. I think I see you trying to talk, but you're on mute. You're still on. I'll see if I can unmute you.
You have to unmute yourself, Carolyn. There you go. You're unmuted.
I've been working with this ever since we've been on, trying to listen. How everyone doing today? I'm concerned. Can you hear me? I'm concerned about my son.
Speak up just a little bit, Carolyn, so everybody can hear you clearly.
Okay. Whew. Can you hear me?
Yes.
Okay.
We can't see you. There you go.
Okay, I'm concerned about my son basically because he been incarcerated and he have a lot of underlying issues as far as high blood pressure, high cholesterol, heart trouble, asthma. He have in his arthritis in his neck, and all these things he captured since he been there. He was not like that. He been there for 8 years. He's supposed to been home. And he also has he's a non-violent offender. He's supposed to been home, but they said due to COVID, they could not release him because they don't have no transport. Nobody is transporting from out there. And I think that's unfair because since he's supposed to been home, he going through all these things. I had to call the government office. I called, and the government called to Ricestown for grieving. I even called there. I spoke with his case manager. His case manager said that if he would have gotten they were supposed to give him 900 days. He haven't had his 900 days yet. So if he had gotten it, he would have been like, if they hurry up and give him that, he would be like walking out the door. So he's sitting still right now. And I had to call to get them to get him out there, which they haven't yet, but he's having really bad issues where he needs to see a medical doctor. And they said that they would do something. I spoke with Miss Sherry from Ricestown. I spoke with Miss Christie from Ricestown, and I'm quite sure y'all would know some of these people. And just each day is critical. So I understand the mom and what she's saying. Each day is critical. They taking all day. If you can put them on quarantine to say, okay, we're going to take them to the doctors. Put them on quarantine and let them out if you know they overdue. They overdo their time. They done their time. Why they're not being released, especially when they have all these underlying conditions. And this is what he have. He's dealing with so many underlying conditions. He's 42 years old, and he haven't been in any trouble for the past 2 years. No trouble. He's been really trying to keep himself together. He have a place to come to that's well kept and everything is in order. So it's not like he don't have anywhere to come. He have if a job he need, it's people I know that for people that have illness like that need to be able to do something where it allow him to keep himself busy. I have people that already on standby for it. He calls me every day. I haven't been able to sleep since the time this had been going on. It's been a year ago that I've been calling and contacting people, and it's like I get calls back, and all they keep saying, the COVID. He can't be moved, but he be the one that be on the list because he pre-release. And even his case manager, I asked her, do you think that he deserved to be, since you put in for him to be released, do you feel that he should get this? She said, yes. I said, well, what is the holdup? She said, because of the COVID, nobody is being transported. Like the mom said, they should make a way for these people to be transported. If they should be out of there, why make them do extended time when their time is up? And then they have these conditions, everybody dying in there, and they not keeping also the inmates, the officers come in there. They're not even being tested. They come in there with COVID, and then here they can walk around without masks, and then look at the inmates. The inmates can't say nothing because then you got bad blood with the inside authority, and they just as worse. They just as worse.
Thank you so much. What you're hearing from our families and Mr. Alonzo Turner Bay is representative of what's going on across the state. Because of Mr. Alonzo Turner Bay, because of Miss Eileen Seipel, because of Miss Carolyn Bates, this coalition is here to demand that immediate action and aggressive efforts are taken to decarcerate the incarcerated population in Maryland. We're here to demand that we must be immediate and aggressive efforts to prevent the further spread of COVID in prisons. We are here to demand there must be a clear timeline for dissemination of vaccines to residents and staff, and much greater transparency and communication about vaccines, vitamins, flu shots, medications purporting to boost resistance. I'm not going to go through the whole list of demands. I'm going to right now, Gary, open up for questions, but please note that our full list of demands are in the chat, and we'll drop them in the chat again before we leave. But we are making this list of demands on behalf of the families that are on this call and the families that are not on this call. And with that, I'm going to stop here and go ahead and open up the questions. I also see, thank you, Sadie, for just putting the list of demands back in the chat for folks who want to access it. And with that, I'm going to go ahead and open up for questions.
Hi, my name is Mark Roper at WMAR2 News. I have a question, a very simple one for both Eileen and Carolyn. Can you tell me where your sons are at, if you're okay to release that information?
At the time, I really don't want to release where he's at because of safety.
Same.
Okay, that's fine.
I apologize.
No worries. I just want to make sure when I'm telling a story that people aren't just wondering, where. But if you don't want to say that, that's fine.
Excuse me, sir. I feel that this is pertaining for each facility that they do have conservated people in. I think that it's not just based on just our children, but it's based on everybody that's in there that don't have no one to speak up for them. So I'm speaking up for any institution that's going through this. I'm speaking up for each one.
No, I get that. That would be the point of me doing the story, but I can't leave out facts, or at least I can't leave out facts without asking the question. But
well, I understand that, but we looking at safety for our kids. We looking at safety for these people where they're not being protected.
No, I totally get that. I'm just saying for my purposes, I have to ask that question. It's fine.
Okay.
I understand that you have to ask it, but things have a way of coming back.
Yes, thank you.
You don't know. No, you don't owe me an explanation. Trust me. I totally understand why you don't want to answer the question. I just have to ask the question. It'd be me like saying if I'm doing an interview with the senator and I don't say, what state the senator is representing, because the people watching, well, Where's he from? That's fine. But I totally get it. You don't owe me an explanation because I've interviewed other family members in the past, so I totally get it.
I will say that in my work with the coalition, that these stories are coming from around the state, and they do
Yes.
seem to be pervasive throughout DOC in every single prison and in most county jails as well.
Yes, my name is DeMaurice Maddox. I have a brother being incarcerated for 44 years. And he's been up for parole 12 times. And it's been on the governor's desk 2 times. But what I really want to speak for everybody also, he was telling me that up in Hagerstown, he's been housing with 24 inmates in a dormitory, and one of them died, but yet they keep sending people back and forth in the facility who has it, but saying they separated, but yet they walking through the population. And he's in there 12 beds on one side, 12 beds on the other side. And everything he do, he had to take precautions. He has asthma, he's recovering from cancer, several things. He's 66 years old. And we've been trying to send out messages to certain people that he's been working with to let them know about the facility, which will be out soon. And I just want you to know that facility is not taking precautions in the COVID situation as they should. And as the lady was telling about her son, or Miss Galaxy, my brother hasn't had any infractions over 30 years. And he still hasn't been released because the governor has not looked at, his petition. But what I'm saying is they haven't also taken any precautions in Hagerstown. You got guards doing 16 or 18 hours sleeping. They don't want to do things because they're so tired. They close down parts of the jail. That's why they housing them like that. They don't have enough guards. They out with COVID. It's just ridiculous.
Thank you. Are you? I hope to see you on our 1 o'clock call as well. Mr. Roper, it sounded like you had a part 2 to your question.
I did, thank you. Not necessarily for Eileen or Carolyn, but actually I guess for yourself, since we don't have Senator Jill Carter on the line, or anyone else that we could ask from the state. But so hearing the concern from people like Eileen and Carolyn, what other recourse is there for these families if they're not getting anywhere with the parole board or anyone else at the prison? What can they do besides just sit back and wait?
Yeah, I'd like to hear that answer too.
Yes, I would too.
I would throw that open to
make
anyone on the call.
happen.
And I see also Lila Meadows is on our call. So Lila, I invite you to chime in anytime you want from a very informed perspective. And I see Martina also. Martina, were you ready to say something?
Well, I mean, I think from the family member perspective, you don't have a recourse, which is the problem, right? That's so problematic, because when you appeal or to Bloomberg, who, if you're in a situation with parole, when you've elevated the issue to Robert Greene, and you keep not getting answers, that is a part of this plea, to hope to get the message out that there is nothing being done. And to call on, quite frankly, the public outcry behind this to say something needs to be done, and to move people in that direction to contact their legislators. I mean, we had Senator Carter, who led the JPR work group, who specifically had recommendations in there that said that you should not be excluding people who have violent offenses and people who are serving life sentences. It said that in the recommendations, and there has been no movement on behalf of Maryland. Zero. Governor Hogan's executive order speaks to the fringes of the people that are incarcerated, the amount of who he's focusing on. How do you have almost 20,000 people incarcerated and then say people with violent offenses, this doesn't pertain to you? Well, that's 80% of the people. So, you know, the call to decarceration, that, you know, there is no real, who do you, you have to sit back and wait as a family. Now, that is the part that is so painful. That is the part that is so painful. That's why you hear pain in Mr. Alonzo Turner Bay's testimony. That is why you hear pain from Eileen. That is why you hear pain from Carolyn and Mr. Maddox and from myself, because you have no recourse. You are powerless in this situation. And we have all done everything we can do for our family members to make sure that they're safe. I tell my loved one all the time, sleep in your mask if you have to.
Yep.
Mr. Alonzo Turner Bay had to write an ARP to get what he was supposed to have been provided. And clearly, if they're making masks out of their anything they have, out of their shorts, clearly the PPE is not getting to them. You're charging them for soap. But, you know, you have no recourse. So, you know, that is why we're having this press conference. That is why so many have championed and gotten behind this effort, because it's not right. I made an initial quote when this first started. You cannot treat people in nursing homes differently than you're treating people in prison. There is no one life that is better or worse than the other.
That's right.
No more value of, but my loved one who's in prison is of no less value than someone's mother sitting in a nursing home.
Yes.
And you're not going to tell me that you're going to treat them differently and allow them to die. It's not fair.
Thank you,
I
Martina.
could also address the question just as an attorney. I think that a lot of focus has been put on the governor, and appropriately so. He's the chief executive of our state, and he is responsible for the response to this pandemic, and not just to the people that he would like to be accountable to, but to all Marylanders, and that includes people behind the walls and our incarcerated loved ones. And so accountability certainly starts with him, and by excluding people who have been convicted of violent crimes from the executive order, regardless of their record inside and whether they've demonstrated rehabilitation, is deeply problematic. But, you know, I think the one group of people who we're not talking about enough, and we should be, is also prosecutors. Prosecutors are responsible for the sentences that are imposed, prosecutors and courts. And so they have a tremendous amount of power in this system to take a look at some of these cases and ask, in light of what we know about mass incarceration, in light of what we know about racial disparities in our system that Delegate Wells spoke about at the beginning of this call, and that Keith and his colleagues at JPI have really brought to light and championed reform around in the legislature, we really ought to be looking at some of these sentences to begin with, and particularly in light of COVID. And so state's attorneys have tremendous power to bring some of these cases back into the courts, to utilize Chief Judge Barbera's administrative order. And I want to acknowledge that work has begun in Baltimore City with the creation of their sentencing review unit. And I know that Prince George's County also has a sentencing review unit that is taking COVID seriously. But the ability to get that relief, as I have for some of my clients, and I want to publicly thank Dr. Bayer for his role in securing one of my clients' release. He's been an incredible champion. Shouldn't depend on where you were convicted in the state of Maryland. You shouldn't have access to justice in Baltimore City that you don't have if your loved one was was convicted in Baltimore County. And so I would also call on state's attorneys to really step up and come to the table and work with families and work with defense counsel to find creative ways to bring people back in front of the courts, because the courts also have a responsibility here to provide relief for people who are in grave danger.
Lila, while I have you, can you just spend about 2 seconds and explain to folks just how poor, just how weak Governor Hogan's executive order was in terms of the amount of folks it touched versus how many it's left behind?
Sure. I think it's hard to do a better job than Mr. Turner Bay did with that, frankly. He put a pretty fine point on it. You know, by focusing on people who are 120 days from release, why not 1 year? You know, is there really a huge difference for us between 4 months and 12 months? I'd love to know how the governor came up with that benchmark, because I think regardless of the rollout of vaccine, which gives me hope, it should give all of us hope, COVID is not going away. And we've seen that the rollout of this vaccine is shameful, frankly, in terms of the pace of it, the way that it's been communicated, and the delivery to our incarcerated loved ones. And so the vaccine is not going to save us from the way that this pandemic continues to move behind the walls. And so the executive order does need to be expanded in terms of people when they're eligible for release, but also we have to recognize that by excluding people who are serving sentences for crime of violence, we're excluding the majority of our incarcerated population, and we're not doing so for any evidence-based reason. Those people are just as much at risk of contracting COVID, but also, you know, we heard from family members, and Mr. Turner Bay is a living example of it. Just because someone was convicted of a crime of violence doesn't mean that they are forever a violent person. And the executive order really ought to give people the opportunity to demonstrate that and gain early release.
Thank you so much, Lila. Thank you. I think we have time for 1 or 2 more questions. Hannah?
Hi, yes. My name is Hannah Gaskell. I'm a reporter with Maryland Matters. I have a few questions that I can follow up with after this is over, but on the demands, we're in the time of year where laws are made, we're in the legislative session. Are you looking to accomplish these demands or achieve them through legislation or via executive order, a combination of the two? And that's for anybody.
Well, can I say this? I think this is something that need to be done by executive order, because we take the process of going through passing legislation. That process, more and more people gonna die. You know, we got individuals who are seniors who've been locked up 40, 50, 60 years. 80 years old, man been locked up 64 years. He's no threat to society. So this is something that the governor needs to take care of come tomorrow morning. Sign the executive order. Order David Green and the Department of Public Safety and Correctional Services Commissioner and the parole board to do something immediately. This is not something that we can take a month, 2 months, 3 months, or another week. You know, the governor must act now because lives are on the line. You know, there's a saying, the house is on fire. There's no time for us to be playing cards. There's no time for games. Individual lives are on the line. You know, people who've been locked up, they doing everything they can to protect themselves. One thing I noticed before I left JCI, it has been going on for the last few years, correctional officers has a running bet with one another on who can make the most money on overtime. Right now, they have been given extra pay during COVID. So you got officers working 2 shifts every day, taking no days off. The governor got to act now, because if not, what we're going to do tomorrow, we wake up, we find out 10 more people died. I know guys who are suffering and who have died because they didn't want to go to hospital. In JCI, they have a tent where they shackle you on one leg and handcuff you on the other while you are sick with COVID in the bed. Your left leg is shackled while your right hand is handcuffed you to the bed. And the tents are cold. Why men and women are getting this humane treatment in America in this day and time? Why we must die, and we wasn't given death sentences. The governor got to act.
And
The
thank you.
women are murdered or die. We die.
Yes.
Thank you so
Mind
much.
you, my brother told me that in Hagerstown, they done put a tent up for people who have COVID and bringing them over there. Now, what sense does that make? And I want to reiterate one little thing. I'm not going to be but a minute. Give me a minute, Mr. Wallington. I didn't state about my brother's situation, which I should have, but I'm talking about everybody, but I just want to throw him in there because that's the reason I'm here, along with everybody else. But my brother's been up for parole in 1993. He was 10 to be released. Okay, but when Glenn Denny signed that bill, life mean life. That's what he said to the press and sent them back. And they turned down every parole that he has petitioned. And the last one, they told him, which was last year, that the reason they don't put it on the governor's desk right now, he has too much on his hand, wait for the next one. Now, what sense does that make? He done been in there 44 years. And when he was sentenced, he was promised by his lawyer, take this plea bargain, and he will get 15 to 20 years. Mind you, the lawyer, because we didn't have money to pay a good lawyer, a friend of the family just became a lawyer for 1 week. 2 weeks. He took his case. I wasn't there because I was in the service. This is what I was told. They didn't tell me anything until I got out of basic. But my brother was sentenced because he took a plea bargain, which he shouldn't have took because the charges they had on him were false. But they trumped them up. And he's been in there 44 years. And I've been trying to get him out, me and my family, along with other organizations for that long, to even get the governor to even answer us. Like he's just thrown away like cheap cattle or something.
So Keith, if you don't mind, I know that, in the being considerate of everyone's time, Hannah, we can certainly talk offline, but I would just publicly say that it's not going to be one magic wand that fixes. It wasn't one bad thing that created this situation. So there's not going to be one good thing that fixes it. It's going to be a host and a suite of things that have to happen in order to make corrective actions to get us where we need to be. So Alonzo and even Ms. Moy, who put in the chat that action is needed now. So there are things that the governor can do now through an executive order. But we are in the midst of legislative session for Maryland. So of course, the parole bill to remove the governor from the parole process for approval for those serving life sentences is back on the table for I believe it's the 10th year, right? Is there, and we are certainly hoping and praying that passes so that, again, people like Mr. Mattis's brother will get a fair chance in that process. There is the Juvenile Restoration Act that is also being put forward, and it's being sponsored by Jazz Lewis, that says if there's someone who has been convicted when they were under the age of 18, that they will get a judicial review after having served 20 years. So that is an immediate mechanism for people to get back in court and hopefully get before judges and then get released. So there is that. And then there is also, and again, I don't see Lila, but she is the expert on trying to redefine what felony murder means for those that were convicted as juveniles, because again, felony murder, if you were committing armed robbery and someone was killed during the commission of that crime, right now, everybody gets charged with first-degree murder, no matter what their parole in the process or the actual offense was. So trying to redefine what that looks like, and so that each juvenile is not then charged with first-degree murder. So there's that. So it's gonna take both. going to take a few things in order to get it right. So executive order, yes, immediate things that can be done, but in the long haul, there are, those 3 legislative efforts that primarily focus on long sentence servers, men and women.
And may I just say also, Martina, that's exactly right. Those are 3 very important legislative pieces that could have very meaningful impact for us moving forward. But in terms of our executive or the demands that we're asking, much of that can be done through executive action. It's great. We certainly will be working legislation, but much of the legislation we're working on now is about decarceration. Many of the recommendations are around, COVID right now. We need action now. You pass legislation now, generally it goes into effect in October that year. That's a long time away when you're dealing with a COVID pandemic. So I think, Martina was exactly right. There's some very important things on the horizon for the legislature, but much of what we're asking for can be done through executive action. With that, may I just ask for our press or media on the phone, on the call, if you have any final questions?
I can follow up with you offline, if that's okay.
Okay, I'd be happy to. I just want to thank you, thank our families first and foremost. Thank you so much. You all are the reason we're doing this. Mr. Maddox, I hope you can join us for the other family call. I sent you a chat. Hopefully you got the information on it. And I also just, I would be remiss not to acknowledge the work that Martina Hazelton is doing to lead efforts, statewide efforts to bring families together, and not just families, but organizations and those that can help move the needle, all working in the same direction for our families. So thank you, Martina. If you are a family and you're looking for some family support, and a way of getting not just information, but sharing, experiences. I think her family support network is an excellent platform for that. And I'd be happy to share how to be a part of that for folks that want to reach out to me. With that, I am going to
give me a title for Martina. I mean, does she have a title that I could use?
Yeah, co-founder of Family Support Network.
Thank you, Martina.
You're welcome.
All right. With that, I think we are all set. Thank you all so much, Dr. Bryant. Thank you so much for joining us.
Thank you. It's been an honor to be with you all. Really has been. Thank you.
Thank you for hearing us out.
Yes, ma'am.
Thank you all so much.
Take care, everyone.
Thank you.
Have a good one. Be safe.